please help spread the message of Frequency Specific Microcurrent by clicking on the like button. You can subscribe to us on YouTube or any podcast app. If you have any questions, please leave them in the comments. You can find the podcast transcription at frequencyspecific.com, as well as more information about Frequency Specific Microcurrent.
Thank you for coming again.
You're welcome.
I am so grateful that we get to spend an entire hour with you. It's like my own private little tutorial that I have to selfishly share with other people. But you and I were trying to figure out all the things that we could talk about, and there are so many. I already had a couple questions that came in when we put it out last week that I was going to be talking to you. So I have some questions. But today, I think we decided we would try to stick to the topic with some autoimmune. And we tried to talk to Dr. Jennifer Sosnowski last week on autoimmunity, and we didn't get very far at all because we talked all about sleep apnea instead.
Oh.
It was a great topic of conversation because as sleep is everything, and I still have the talk that you gave years ago at the Advanced all about sleep hygiene. And it's one I think you need to repeat at some point because everybody needs to sleep and how to sleep well. And there's so many things that we can do.
How about this coming March? Yeah, I talked to Carol about it. And so I'm hoping to not just repeat it, but there's all this new material about sleep and things I've incorporated how to get people sleeping. Because even in regard to autoimmunity, the immune system gets very disturbed if you get 6 or less hours of sleep.
Yes. We all need good sleep. And that is one thing that I'm so fortunate between my watch and my ring. I'm getting 2 sources telling me that I am logging 8 to 9 hours a night. So I'm happy.
Then I won't talk to you about all the EMF you're being exposed to with those devices.
I know that's the other part of it.
Since you're such a VIP in the FSM community and you're so wonderful that you should not use those devices more than once a week.
Okay.
Maybe once every 2 weeks, just to monitor, because you're getting exposed to Bluetooth while you're sleeping.
Yes.
Not a good idea.
No.
Monitor once every few weeks and just see how it's going and then leave it at that, because too many people are monitoring every night and then they're getting exposed at the same time they're sleeping.
Right. That will transition into some of the other things that we're going to talk about with autoimmune. Everybody that is listening to us live, feel free to start throwing some questions for Dr. Musnick in the Q&A or in the chat. Let's try to keep it as autoimmune related as possible. It's really hard when we have his big brain sitting in front of us because we want to ask him all the things. But one of the platforms that I like to use this podcast for is to not just talk to FSM practitioners, but we have so many lay people that just listen to the podcast and are getting introduced to not only what we do with FSM, but what we use as our own adjuncts to FSM. One of the big words that we've been hearing so much about autoimmunity is the fact that it's a scary word. We're hearing things, oh, I have an autoimmune condition, and there's so much doom and gloom and hopelessness that I, as a practitioner, around that. And I think there's so many things we can do to help empower and enable the patients and clients that we work with to do things holistically and to maybe take charge of their own health. So I'm going to guide you down that path as much as possible. And for the healthcare providers that are listening, how we can best help our patients if we're not medical doctors, who we can refer them to, what kind of labs, etc. If somebody suspects that they have an autoimmune condition, what is the best course of action for that patient to do? That's probably a big question.
Doctors don't randomly order anti-nuclear antibodies or autoimmune antibody screens for patients unless they're concerned that they might have a constellation of symptoms that could be an autoimmune condition.
Do you think screening people for ANA or autoimmune conditions should be something that we should do?
Yes, because it turns out that there's these things called predictive antibodies or precursor antibodies where the antibody screen will be positive before someone actually has an autoimmune condition. So that during that period of time, someone who does this type of work could possibly detect these antibodies and reverse the condition so that the person does not develop a full-blown labeled autoimmune condition. So as it turns out, we produce the different antibodies to tissues before we have full-blown manifestations of these conditions. So yes, and then the question is, okay, what would it be? Because the anti-nuclear antibody is a really bad one. And I'm not trying to scare anybody, but it means someone has an immune response to their own nuclear material. So that's a big deal. There's all kinds of antibodies screens that could be done. And in answer to that question, yes, I think someone should be able to go to a physician and say, look, I'd like to potentially get an antibody screen to see if I'm at risk of autoimmune diseases or if I got any early antibodies. And then there are a number of labs that do these. Cyrex Labs, CYREX, has a really good, very diverse antibody screen. And I would break it up into antibodies for the body below the brain and antibodies in the brain. Because if someone's interested in their brain, which is a funny thing to say, who's interested in their brain? People should be interested in their brain, but the average person doesn't think they need to take care of it. Do you know what I mean?
Yeah,
But
no.
if someone was saying, I think this is a good health goal to take care of my brain and prevent autoimmunity in the brain, because what a lot of people don't know is our immune systems are developing antibody responses to many different tissues in the brain. And so there is a panel someone could get to look at that and pick that up earlier than if they're at risk for Alzheimer's or they're at risk for cerebellar issues or all kinds of things, blood-brain barrier antibodies. So I think ideally, if someone wants to be really healthy, they should get a screen of antibodies for their body and antibodies for their brain. But then the average doc would not know what to do about it. So they'd probably have to see a doc that was trained not just in functional medicine, but functional immunology. So functional immunology is a branch of functional medicine that someone has to decide that they want to do and take a really deep dive into it, because it's literally probably, I don't know, like 500 to 1,000 hours of extra training. It's an unbelievable amount.
Wow.
So I've been doing that, and it's fascinating stuff. But if you find early antibodies and you say, okay, how are we going to approach this? Because I think we really can prevent full-blown autoimmune conditions.
I think that's probably one of the biggest issues, because you're right. A lot of people aren't just saying, I would like an antibody panel, or I think I am at risk for autoimmune. Good to know that there are tests. So Cyrex, like you said, and who knew that there were two different panels, like one for the brain and one for the rest of the body? That in itself, my mind is already spinning in 1,000 different directions, because that I don't think is common knowledge whatsoever.
Well, the interesting thing is that the so-called specialists in autoimmunity are labeled rheumatologists. A
Right.
lot of them do not know that there are panels available to screen for autoimmunity in the brain. So you could literally go to a rheumatologist and they don't know that you can do this type of screening, which is concerning. But also, I think one of the problems with seeing a conventional rheumatologist is they don't look at causes, like what caused the autoimmunity. They just look at labeling it and trying to match it with a treatment, usually a biologic. But what we really need to do is look at causes and underlying causes that can cause autoimmunity so we can decrease exposure to them. We need to look at triggers and decrease triggers, because triggers will set people into an autoimmune response. But the other issue that's totally fascinating, and you probably know this because you're brilliant. I'll always pass out the compliments, is that if a person has an autoimmune condition, the highest risk for having an autoimmune condition is already having a different autoimmune condition. I have seen patients that came in the first time. I was just diagnosed with my 4th autoimmune condition. What can I do about this? And because the causes that could predispose someone to one can predispose to another. And rheumatologists aren't looking at that either. And it's extremely important, because you don't want to develop any, let alone more than one, let alone like this 27-year-old that came in like a couple of months ago with 4 of them. That gets into causes, that gets into prevention, that gets into treatment and all these things.
So I'm going to stop you right there once again. So if you Google autoimmune condition, all these very similar definitions will pop up, and you'll see common things like unknown cause and no cure. And I think conventional medicine has been really happy with, oh, we don't know what causes it. And everybody's been okay with the fact that we don't know what the cause is.
Well, I don't think everybody's okay with it.
I don't think functional medicine doctors are okay with it.
Right.
I'm sure there's a good group of allopathic medicine that realizes that they shouldn't be okay with it. But for the most part, I think we just hear and see a lot of the unknown cause, and everybody's just accepting it. Maybe we're not okay with it, but we're accepting that.
Right.
So what could some causes be?
So one of the biggest causes is probably toxicity and toxic burden in the body, because here's a concept, okay? So if you're an immune cell,
Yep,
patrolling around, looking at everything like, okay, is this me? Is this not me? If it's not me, then I need to tell somebody, and I need to go to the headquarters, and then we're going to analyze the situation. We might mount an immune response, right? Or if you've already been exposed to something, if that immune cell has already been exposed to something and ready to what we call clone, or you could call it Star Wars, the Clone Wars, and they clone hundreds of thousands of copies to go after something. There's a bunch of categories regarding what can cause autoimmune conditions. One is toxicities. You can imagine if toxins are in a tissue, then the immune system may look at it and say, I don't know that this is me anymore. So there's many different toxins that can be in tissues. So now it's felt like mold biotoxins can be a cause for this, that they get into tissues and the immune system cannot figure out. That's self. And if you get like a toxin panel, some of the companies are doing these big toxin panels. There's some very serious toxins that are in our bodies that could predispose to developing autoimmunity. Then the spike protein is now a new theory on why autoimmunity develops, the spike protein. And because so many people have been exposed to that by getting COVID or getting the shot, so that's another possible cause, because it's been found in autopsies to be in a lot of different tissues. There's some theories, and I agree with them, that barrier dysfunction is related to the development of autoimmunity, like intestinal permeability, which is also called leaky, whereby the dendritic cells that are on the other side of the intestines, they're like waiting for things to go through. But if it becomes leaky and the body develops immune reactions to its own tight junction. And so most people don't know this, but leaky gut is an autoimmune disorder, because the diagnosis of leaky gut now is based on antibodies to tight junction proteins. So it's actually an autoimmune disorder itself. And because those tight junctions are also in the blood-brain barrier, very frequently, if people have leaky gut with that autoimmune disorder, they may have a leaky blood-brain barrier. And then that predisposes to all kinds of problems in the brain. And what I've been finding when I order those tests, it's a very high incidence of people that are testing positive for anti-zonulin, anti-actin, and anti-lipopolysaccharide, which is very concerning, because then you say, why do so many people have intestinal permeability? Probably one of the reasons is because of the glyphosate and Roundup we're all being exposed to, because it's very damaging to the gut barrier. So you can say, okay, genetically modified foods, and the amount of exposure to genetically modified foods can potentially predispose a personal intestinal permeability, which then can contribute to development of autoimmune disorders. There's genetic issues for sure that are related to the development of autoimmune disorders, but it's always like a combination of genetics and triggering factors. There are intestinal infections that could predispose to autoimmune disorders. There are food allergies that could do it. Like celiac disease is associated with a higher risk of other autoimmune disorders because it's so much associated with intestinal permeability. Celiac disease, but you could have someone with a dairy allergy. So some of those like wheat and dairy are more serious than some other allergies, but that literally it could go into an autoimmune disorder. The mechanism of molecular mimicry is whereby the immune system is thinking that something is abnormal and going after it, like parts of dairy, and then instead it goes after parts of the brain. So I always tell people, for 8 weeks after a concussion, you can't eat wheat or dairy because the immune system could go after parts of your brain because of this molecular mimicry thing. So there's a lot of possible causes, and the rate of autoimmunity is just skyrocketing.
Yes.
And it's skyrocketed since 2020. So you probably know what that means.
And that's one of the reasons why I think we are hearing and reading so much about it right now. And I think our job is to give out useful information. Like I said, my goal as a healthcare practitioner, wellness provider, whatever you want to call it, coach, is to give people the tools and to give them the power back to take control of their health. So what you had just unpacked, so much about diet is really within our control. It's very expensive to eat well in America, but I think that is one thing, if you look at, opposed to all these medications and the cost of healthcare, cleaning up your diet is one of the things that most of us can at least make a solid dent into that. You mentioned gluten and you mentioned dairy. Are there other things that you tell people to get rid of right away or eliminate?
What I would do with any autoimmune is I would get an intestinal permeability test for sure on the patient, because I want to know if I've got to heal that, because it's like a portal of entry. Then I would also like a really good food allergy panel that not only measures IgG, but also IgE and complement. And there's a number of panels out like that. The test that I get for intestinal permeability also checks for gluten and wheat because I need them to get off of that. I want to base it off of that kind of data because if someone's got very strong allergies to certain foods, then I want to get them off of that. If they've got moderate allergies, they might be able to rotate. But oftentimes the base level issue is leaky gut. But I want to talk about something that I forgot to say about causes because I don't want to forget this.
Yeah.
The biggest potential causes of autoimmunity is infections. There seems to be a very high correlation between chronic infections and the development of autoimmune disorders, especially Lyme disease, but co-infections of Lyme disease, Bartonella, Babesia, Rocky Mountain spotted fever, and the chronic or reactivated viral infections, Epstein-Barr, West Nile. So let's just say I'm treating a person with brain dysfunction, cognitive impairment. I'm going to look for causes for that. If I find antibodies to brain tissues, I'm going to start searching for chronic infections. Oftentimes you find them, and you got to treat those as well.
Right.
Because what if someone is still reacting to Lyme and they've developed an autoimmune disorder and the underlying infection is not being treated?
Sure.
So it's extremely important to screen for those things as causes.
The food panels, you mentioned labs. Do you like them for food sensitivity testing, or are there other sources for labs?
Yeah, so that's something interesting with one of their food allergy panels more. They cook certain foods that are not cooked in other food allergy panels. For instance, most people don't eat raw beef. So it cooks the beef to present it as an antigen, chicken and certain other things. If I had my way, I would get that panel, but that's still only IgG. And I would get a panel like Infinite Labs or Precision Labs, the Fast 88, because those panels not only check IgG, they also check IgE. Because I definitely want to know if someone's IgE allergic, because they have to stay off those things. Those are the really serious ones.
For the lay people that are listening, can you explain what IgE, the difference between those are? Just briefly.
So an IgE food allergy is a much more serious allergy. It's like the ones you hear about peanuts or shrimp or something, where if someone gets exposed to those foods, they could actually go into shock. They could have hives. They could swell up in their throat. They're extremely serious, very quick onset allergies. And that's why they don't serve peanuts. Like if you go in March, when I board a plane from Boise to go to Arizona and you board a plane from wherever you board your plane, Oakland or San Francisco, they're not going to offer you peanuts because they're concerned about IgE allergies to peanuts. Sometimes, though, if you're in first class, they'll offer you cashews. And so people do not have, there isn't that broad spread IgE allergy to cashews. as there is to peanuts. I do think that any doctor screening for these things needs to find out, does that patient have IgE allergies for sure? Because you have to have the patient stay off of those. And then everybody's checking for IgG, but that's less serious. Those are things like stuffy nose or headaches or joint pain or whatever, theoretically less serious reactions. But then there's some other ways to look at these reactions, like activation of complement. So the more things that are happening with an allergy, like activation of complement, high levels of IgG, if I see both of those, I say, you've got to stay off of it. That's almost as close or as bad as an IgE allergy.
Right.
So I would say that if we're really trying to be comprehensive, I'd like the cooked panel with Cyrex, and then I would get a different panel for the combination of IgE, IgG, and complement testing for food allergies.
This is not the go to the allergist and the scratch test on your back panel.
No, those would be more inhalant things.
Yes. Yes.
Skin reactions.
Yes.
Correct.
Because some people will say, oh, I went to an allergist and I don't have any food allergies.
This is more accurate for food-related allergies.
Yes.
Tests can be fairly accurate for inhalant-related things you inhale.
Sure. So I think that's just a great first step for people to know that they can start ruling out food. I think it's important to not paint everybody with the same brush. So like we hear, oh, don't eat gluten, don't eat dairy, don't have soy, don't have corn, don't have nightshades. That doesn't work for everybody though. The best diet is
Italian. The tomatoes are. Right. Yeah, so I don't think it's good to say that to people. Just like you could do an elimination diet for a certain amount of time, but then it's probably better to say, okay, look, if we don't know what's going on, we can test for it. Sure. Then you don't have to eliminate. We can test for it. Although the gold standard is elimination and challenge. I don't want to eliminate and challenge an IgE allergy food, though. That would not be good. So that's why I think testing's important in that. But I don't think people should stay off all these things indefinitely. I think it's better to test for these things and then tell them to stay off because this is what the test shows. And sometimes it does change, although IgE allergies don't usually change, but IgG allergies can change.
I'm trying to remember, there was a food plan when we were in Arizona a couple of years ago, and I had tried it. I think it was Gundry's lectin-free diet, and I felt terrible on it. As a
hard diet to do.
Yeah, it was. I think it was just not enough carbohydrates. I was training, I was running a ton, and it just wasn't enough. But I'm always open to trying things, especially things that potentially could make me feel better and run faster and sleep better. So there's a couple questions here before we go any further. Somebody asked about the Ring. Does the Ring pump out EMFs even if the phone isn't actively monitoring it?
Yes.
Okay.
That's my understanding.
Okay.
That's my understanding of it, but I have to look a little more into it, but that was my understanding because that would be good actually for me to get one of those rings, and because I've got test equipment, I can measure it. Okay. But I'm almost positive it is.
Yeah, you're right. We don't want to be monitoring and then potentially just exposing ourselves to things that could be making us worse or not.
But I will tell you something that this would be valuable for your audience. I can't believe how many patients come in, say, with cognitive issues or autoimmune issues. And I talk to them about electromagnetic fields because there's information that electromagnetic fields will damage the blood-brain barrier. That is definite. And not necessarily the gut barrier, but the blood-brain barrier. And so virtually all these people are sitting there with their phones. The Bluetooth is on, the Wi-Fi is on. And if you take test equipment, there's a lot of exposure just from their phone. And if they would just take the Bluetooth, turn it off, take the Wi-Fi, turn it off. And same thing if they get an Apple Watch or another type, take the Wi-Fi and Bluetooth and turn it off and turn it into a watch. Right. They'll save themselves a lot of that exposure.
Yeah, again, so many things that you can do to just minimize things. We talked about this pretty extensively last week with Dr. Sosnowski with sleep, turning the Wi-Fi off at night.
Yeah.
and how some of the kids that she's working with autism or on the spectrum, how they're so sensitive to EMFs, and how just turning Wi-Fi off at night had drastically improved their sleep quality. I think about Dr. Roger Billica talking about the story about a teenager, and it was almost like psychotic episodes that they couldn't figure out what had happened. And then it came down to they had moved his bed into a different area, and there was just so much electricity around right where his head was. They moved his bed and he was a different kid. Fascinating stuff. So going back to one of the questions that we had, it says, I understand the connection between gut and immune function. My question is about parietal cells. If the immune system is attacking the parietal cells, is there a way to protect those cells while attempting to recover an autoimmune condition?
Okay, so maybe I'll interpret that question because it's actually a rather sophisticated question.
Yes. Summer Rich is very sophisticated. We love
What?
questions. The
Yeah.
person that writes a great question. So thank you, Summer.
Okay, so parietal cells are in the stomach, and there is a condition in which there is autoimmune effect on the parietal cells, which can be called pernicious anemia. So when someone actually has autoimmunity to parietal cells, they don't produce as much stomach acid potentially. So then they can have that kind of dysfunction.
Yes. Is there a way to protect those cells while attempting to recover an autoimmune condition?
I would have to speculate on this because I couldn't say yes, 100% you're going to protect the parietal cells, because you'd have to say, okay, we don't want the immune system getting near the parietal cells when the immune system is already primed and cloned to go after them. So what you'd have to do is figure out any trigger. And this gets into this whole issue. Okay, someone has an autoimmune disorder. What can you recommend besides the biologics that the rheumatologist recommended? Or if they want to get off of a biologic because they're really concerned about the list of side effects this long. You ever seen a TV commercial on a biologic? It says, start listing the side effects. So one of the concepts is you don't just want to take a biologic, you want to assess and heal barriers. You want to assess and heal anything that can cause this molecular mimicry. You want to look at any infections that might be related to this thing perpetuating. And you want to actually balance the immune system, modulate it. Part of this whole thing about how do you protect the cells that the immune system is going after? In this case, parietal cells. Well, you could use something to increase mucus in there. So there are a number of products that increase the layer of mucus in the gut that might help decrease the attack of the parietal cells, but really you want to decrease the triggering events because that's just going to get the immune system active. So in that case, I'd say get the 2 different food allergy panels. I would stop and will affect the barrier. I get rid of those. I tell them to not eat hot, spicy foods. I tell them to avoid all GMOs because of the breakdown of the barrier with that. But then the immune system would need to be relatively balanced, which is the functional immunology approach to autoimmunity. What's interesting is Cyrex Lab actually has the most comprehensive test to evaluate the whole immune system.
Okay.
So it's one blood test, but it gives an unbelievable report of the status of the whole immune system. What's the relative population of Th1 cells versus Th2 cells, Th17, CD57 cells, natural killer cells? And so in that situation, I would want to get that test with anybody with an autoimmune disorder to just say, okay, let's look at your immune system.
How much would a test like that fluctuate, or how many times would you recheck something like that? Once a year, every few months? Would that depend on what they're changing?
Yeah, I would only check it when I thought they had enough time to respond favorably to it, and I was making interventions so that it would change.
Right.
There's all kinds of patterns in autoimmune disorders, but if the immune system stays in certain patterns, it's just going to keep perpetuating the autoimmune disorder or leading to another one. So that's why I do think that particular lab test would be good for anybody with an autoimmune disorder, for someone to look at it, analyze and say, okay, what does this look like in terms of the different aspects of your immune system, and what can we do to modulate it, to improve it, to balance it? I don't like the word boosting. That is used as an adjective for the immune system, and I think it may be slightly appropriate for boosting natural killer cells or something called the Th1 helper cells
Mhm.
to fight viruses.
Yeah.
Quote. But in general, you want to balance as opposed to boosting.
Sure, that's a good. We like words on this show. We talked a lot about food as being triggers. What are some other triggers that are out there? We think about stress, we think about sleep.
Stress is one of the biggest ones.
Yeah.
I find out a lot of people developed an autoimmune condition during a period of prolonged stress.
Sure.
So that's really important to manage. Inadequate sleep will lead to dysfunction of the immune system. You know how if you get inadequate sleep for a number of nights, then you could just get sick. You could not even leave your house. Inadequate sleep, and then you're going to get a virus that you already have, that your immune system is containing, which that brings up an interesting question, even though you didn't ask it. So here's the question. What is the condition called a reactivated virus, and why is it important? Because it's an immune system dysfunction where the Th1 natural killer cell, part of the immune system, cannot contain a virus or viruses. And then they start multiplying out of control when they were contained. But that can also trigger an autoimmune flare or even an autoimmune condition.
Right. Yes. That's so interesting how you talked about a couple nights sleep and then all of a sudden you're sick and you didn't leave your house, because that does happen all the time. We always joke that our kids would always get sick after Halloween. Between the lack of sleep and all the sugar, it was just a perfect. So stress, there's a lot we can do to help people with stress, especially with FSM. A lot of us are in that field of helping people. I think you had mentioned it at last year's talk, or maybe it was the year before, about tapping. I love tapping. I tap myself. I recommend tapping to people. I think it can be very helpful, especially when they are newly diagnosed with an autoimmune condition and then they have so much stress, which is on top of how to manage the autoimmune condition, which doesn't help the autoimmune condition.
One thing that's really important that you probably know about, and I don't know if you had another guest talking about this, is labeling the person with an autoimmune condition. Then the person labels themselves with it. And that's a problem, because if you feel so deeply that you have lupus or you have this or that, it's hard to get better from it.
Yes.
And you just keep almost like using it on yourself. It becomes part of your identity. I do not think that's good at all.
Right.
I think it's better not to even use those terms. At the present time, I have autoimmune antibodies. I have these symptoms. I intend to get better.
I was talking to a friend who's a psychotherapist who was talking about anxiety and depression, and their approach is exactly the same. Instead of saying, I have anxiety, it's no, you have anxious feelings right now. There's a completely different approach with just those two things. Everybody feels anxious from time to time, right? Like, we're human beings. So I think that's a really important step. And whether it's about autoimmune, or we talk a lot about this with frozen shoulder. People love to self-label. I have frozen shoulder. Could we also just say you have a shoulder that's not moving as well as it could potentially?
Yeah.
Completely different.
Because less likely establish the thing from being there and staying there for a long time. It shouldn't be. A disease label should not be a part of a person's identity. And I felt like this a long time. And there's actually a book that Jeffrey Bland wrote about diseases, and that they don't actually exist like that. They're labels for a constellation of either lab tests or symptoms or whatever. And because you want to feel like you could heal from something, you could get better. There is this whole issue about, could someone 100% heal from an autoimmune condition? That gets very tricky, because most rheumatologists say no, they can't. The vast majority of rheumatologists would say no. But I've seen people with a functional immunology approach go down to not have the antibodies anymore and be relatively symptom-free. And so I think people should hold out and say, yeah, I want to get completely better and I don't want to think about the label. Which brings up another issue, which is interesting, which I don't know if you've started doing this. I want to know if you're doing this during FSM, but when I started doing FSM, I assign imagery or affirmations to the patient while they're getting the FSM. And I actually asked them, like this lady today, lady today had the most severe constipation I've ever seen in my practice. And I said, okay, this is going to sound funny, but while you're there, you're going to imagine that you're going to freely have bowel movements every day during this whole visit. You're going to imagine what life would be. Like if you even have to worry about having bowel movements. So I've started doing imagery with almost every person. But I don't ask them to think about the disease label. I ask them to imagine if everything's working properly, if everything's going great, what would that be like while they're getting the FSM? And I think I'm going to even have better results than I usually have. But it's still early in that process because I started doing it about 3 weeks ago.
I've been doing this for a little while, and I have to say, working with athletes, imagery is a huge component of it. So we would start with, when you are healed from this injury, what is your first game back going to look like? What does success mean this season to you? But using it with, quote unquote, the average person has been, if not more successful. So it's saying the things like, when this is healed, what are some of the first things you're going to do again? Picking up my grandson. I'm going to go grocery shopping and push the cart without pain. And then saying the affirmations. I was working with somebody who we had a very successful treatment on the table, and then it was time to do some corrective exercise. And the first thing they said was, "Oh my gosh, this is going to hurt so much, isn't it?" And I was like, that just undid everything that we just did, because the thought was back to movement is going to cause pain. So what we would say is, and my favorite 3 sentences are, I feel strong, movement feels good, etc., etc. So even just saying I feel strong, movement feels good, and then I feel safe, right? Movement should feel safe. I think healing has to feel safe. And I think some people are afraid to heal because that might mean something very different. And you alluded to it, it becomes their identity. So we talked a lot about managing autoimmunity when maybe somebody mitigate the symptoms, but the other side of the patients that are coming in are the patients that have been sick for a really long time. And maybe they don't even know it was an autoimmune condition. They're just finding all this information out. But being sick has been such a component to who they are.
Yeah.
And I think it's really important that we can help separate them, and not saying I have this autoimmune condition, but how you were phrasing it, I have some autoimmune markers that I'm managing right now.
I have these symptoms, I have these signs,
Yes.
but I intend to get better. And the other thing about it is that we can talk to patients about staging. Okay, here's a timeline. We're going to start here. We're going to get all the antibody tests. We're going to get the food tests. We may analyze your whole immune system. And then we're going to develop a plan based on all that data. And you'll start on this food plan now, but we're going to change it. So they see a timeline of, you know, the way things could go. Okay, and then I assessed your vagus nerve. It's not working as well, so we're going to get that working better, and we're going to eliminate some toxicity with sauna or whatever. Come up with a timeline and a plan to deal with the causes and whatever, so they have something to look forward to and say, okay, then I expect by this amount of time that the end, because you got to treat the immune system and you got to treat the end organ too, that
Right.
the immune system is, so FSM is great for that, treating the end organ, calming it down, and treating the vagus. And then it just depends what else needs to be done. But you can also treat barriers with FSM, like the blood-brain barrier, like the intestinal barrier. So I think that practitioners, when they're treating autoimmunity, have to think about, yeah, what are all the things that I can use it for? Am I going to stage in different things? And so given a timeline, I think is really important to people, and having them stop using the label against themselves.
Yeah,
Giving them some hope too, because the people you're talking about have had this for a very long time.
Yeah.
It's so ingrained in them that you really, but most of the patients that I've found, I haven't had much resistance to this positive imaging, not using that label against yourself anymore. I talk to people, it's, hey, would you put a sweatshirt on and wear it every day? And that sweatshirt is like the lupus sweatshirt or the rheumatoid arthritis. I said, that appears to be what you're doing when you keep labeling, you keep using this label against yourself. So try not thinking about that name, lupus, rheumatoid arthritis, whatever. Just say, okay, it's my immune system. I'm working on it. It's going to get better. I'm not going to actually think about the label constantly.
Yeah.
Because that really makes it more difficult to heal and get better.
To build on this, I hosted a little California hybrid course a month ago, and we had some people who had taken the sports course and other courses, and we're doing a little refresher. And we had a very, very important group in this room. It was a really unique meeting of the minds. It was very inspiring to be around. And we had talked about the labeling of certain frequencies, right? So we have 124, which is torn and broken. And those are terrible adjectives, torn and broken.
Yeah.
Somebody said, can we start saying repair and heal? 124 is now repair and heal. And I was like, yes. So right away,
Oh, that's interesting. Wow.
it changes the trajectory. I know, like with athletes, like we have to change, where will they see concussion on their custom care, because they change it to neurocom or best sleep or I change it to suit
Good idea. Changing the names of programs even to be more positive.
Yes. So torn and broken, folks, is now repair and heal. That's our new one.
What do you call 321?
Oh yeah, paralysis. I'll just say this isn't moving right now. So we could call, instead of paralysis, we could say improves movement. We might have to change a whole bunch of verbiage. Derek on the question just said, I can confirm positive affirmations work. This is like telling the taxi driver where you want to go. And I think, again, it comes down to like control and feeling safe. And I think it doesn't matter what kind of practitioner you are, our job, whether you do FSM or not, is to make your clients and patients feel safe in your care. Nobody is going to move if they don't feel safe to move. I don't push people to move. I don't like the phrase holding space, but I think our job is to just give everybody that safety to improve their health, improve their movement, however that is. And we can just facilitate and cheer them on along the way. That's my little positivity. Going back to some of the questions, Derek asks, could Alzheimer's and dementia be autoimmune related?
Yes, they can, because there's predictive antibodies, and I can't remember exactly what they are. There's a really good test panel for that, which is a lab called Vibrant Labs in California does a NeuroZoomer Plus, which measures every antibody they know to test to all the brain regions. And there are a number of predictive antibodies on there for Alzheimer's disease. Although I don't think Alzheimer's is totally an autoimmune mechanism, there is probably an autoimmune mechanism. And for a lot of people, there's probably a chronic infection mechanism that is now being correlated. Alzheimer's is being correlated with chronic Epstein-Barr reactivated, Lyme, mold biotoxins. So I think it's a combination of an autoimmune process with a lot of neurotoxicity, with a lot of neural inflammation, blood-brain barrier breakdown. But the blood-brain barrier breakdown might be traumatic initially, but then it can become autoimmune. Yeah, I think Alzheimer's is partly autoimmune. I don't think it's usually 100% that way.
Do you think we hear so much too, the big phrases are chronic inflammation, I'm chronically inflamed. Do you think that phrase is also being used to describe autoimmune conditions?
So a person can have a lot of inflammation or chronic inflammation without having an autoimmune condition. So then they have immune system dysfunction. There's a lot of inflammatory aspects that are going on, but they may not have autoimmunity. They may not have autoantibodies. They may just have a lot of inflammation. And they might have it in the brain, they might have it in the body. Often if you have it in the body, you have it in the brain. You're more likely to have brain problems with chronic body inflammation if you have a blood-brain barrier that's dysfunctional.
One of the questions was, how do you treat the blood-brain barrier?
That's a good question. So you decrease EMF exposures because that's directly linked to damage to blood-brain barrier. And then, yeah, if someone had a blood-brain barrier antibodies, I would want to confirm they also had intestinal permeability. And so then I'd be using butyrate for the brain and the large intestine, because you got to treat the small and the large intestine. I'd probably use peptides like BPC 157 orally, at least, because one of the things you got to do for the blood-brain barrier is you've got to heal the leaky gut, because if the immune system keeps going over those junctional proteins, then they're going to go after it in the brain too. And so then you actually have to heal the microglial populations that are going to go after the blood-brain barrier. So you have to do things to convert the M1 phase of microglial cells to an M2 phase. Things like getting more apigenin in your diet from parsley, or putting parsley in a blueberry smoothie to get apigenin, getting more luteolin, because that helps the balance of getting the cells into an anti-inflammatory phase in the brain. And then I would use FSM for the blood-brain barrier. And then it gets tricky because you say, okay, what am I going to use? A frequency for arteries or a frequency for capillaries? Probably a frequency for capillaries, because the blood-brain barrier is really small stuff. I would use condition 1 frequencies, and on channel 2, I would use 162. But I would put a whole bunch of condition frequencies in there now, all the toxin frequencies. Then if you know they have viruses, then you have to treat the viruses. So I'd at least use 160. Then if you know they have mold biotoxins, I'd use 23 and 95. So there's a whole bunch of condition frequencies if they have this going on with 162. I treat the spike protein. There's a whole bunch of things that are affecting the blood-brain barrier.
Sure.
There actually is a frequency, and I think it's 957 or something. I'd have to look it up for EMF.
There is. I've made an EMF protocol, but I would have to look those up also. Those don't stay in my brain.
Just one thing I want to say. I know this sounds gross, but I am stuffing 2x2 and rolling it up and sticking it in people's eardrums and putting clips on to deliver it better to the brain.
I think you can. I don't know how many practitioners could do that or would do that, but yeah.
It seems to be working better. If I want to deliver 2 different programs to the brain, I'll deliver one through alligator clips and one from the neck to the forehead.
Yeah.
Usually. But I started thinking about this. It's either like up the nose or in the ear canals. And I tried a few patients up the nose. They go, no. But in the ear canals, they'll do it.
Wow. Denise had asked the 2 lab companies that you were recommending. I think it was Cyrex, right? And then you were talking about Vibrant.
Yeah, but then there's another lab company for the IgG, IgE, and complement food allergy testing. I think one of them is Infinite, one of them is Precision. There's a number of labs that do that type of food allergy testing. Okay. So of all those labs, they don't do mold biotoxin testing that we talked about, and they don't do Lyme and co-infection testing. Those are other labs.
Okay. Somebody had asked, are there any cases of FSM helping myasthenia gravis beyond diet, gut health, vagus, etc.? I don't know of any offhand.
That's tricky because then we'd have to say, okay, who's had myasthenia gravis patient? I'm just trying to think. I think I've had a few, but not many. But I have helped them, because the worst thing that can happen with myasthenia gravis is respiratory depression where they can't breathe. Sure. But I haven't had any recent myasthenia gravis patients, but I'd still approach them the same way I'm talking about.
Yes. Okay. Summer also is asking, where is Dr. Musnick's office? You are in
Idaho. My main practice is in Eagle, Idaho. I do telemedicine. Someone's not in Idaho, because I have a license in Idaho and Washington. I also still go back to a clinic occasionally in Bellevue, Washington.
Right.
But I do telemedicine. And so when somebody is not in Idaho or Washington, then they have to have something called a peer.
Yeah.
We've done that with one of your patients.
Yes, thank you for that. So yeah, there's lots of ways. If your website, peakmedicine.com, I believe.
Yeah, so that's the Bellevue website.
Okay.
www.peak, like reach your peak. The Idaho website is www.fmi, for Functional Medicine of Idaho, fmioptimal.com.
Perfect. There was one more question, I believe, before do you do telehealth in Hawaii?
Yes, as long as either someone is from Washington or Idaho, or they have a peer that's any type of medical license. During COVID, those rules went out the window.
Right.
We're doing telemedicine with anybody in any state. The rules went out the window. But I can't remember when they came back.
Right.
Because this is the United States of America. Every practitioner should have when they get their license, it should be for all 50 states.
You would,
But
yes.
it isn't. And so you have to apply to each state to have your license. So you're supposed to see patients that you have your license in, unless there's what's called a peer. So the other day I was doing a consult with someone in Tennessee, and they just had a nurse listening in. All they do, the peer just listens in.
Yes.
Sometimes I've had people that were docs that were peers that just wanted to learn.
Yes.
Then they were the peers. I've even had massage therapists be peers or whatever. Just somebody on the team.
We are so grateful for you. I'm so grateful to call you my peer. You've helped so many people, including me and my family. Thank you again for giving us an hour of your time. That's it for today, everybody. So big thank you to Dr. Musnick. I always learn so much when I'm around you. And thank you for giving your knowledge and just giving so much knowledge to the people that are listening and spreading positivity and hope and all the good things.
And thank you for having me.
Thank you so much. All right, everybody. We'll see everybody next week. I believe Dr. Carol is back. So we'll see everybody then. Have a great week. Bye.
Okay, bye.
Thank you.
The Frequency Specific Microcurrent podcast has been produced by Frequency Specific Seminars for entertainment, educational, and information purposes only. The information and opinion provided in the podcast are not medical advice, do not create any type of doctor-patient relationship, and unless expressly stated, do not reflect the opinions of its affiliates, subsidiaries, or sponsors, or the hosts, or any of the podcast guests or affiliated professional organizations. No person should act or refrain from acting on the basis of the content provided in any podcast without first seeking appropriate medical advice and counseling. No information provided in any podcast should be used as a substitute for personalized medical advice and counseling. FSS expressly disclaims any and all liability relating to any actions taken or not taken based on or any contents of this podcast.